starts now.
Thanks for joining us tonight. I'm Don Nelson. Michelle is off the desk. Our top story at 10. Idaho's prisons are so overcrowded, we recently had to send more inmates out of state. At the same time, we are suffering from a severe lack of mental health facilities. Roland Barris joins us live in studio with more.
Yeah, Don, police and prison officials say that too often leads to people with mental illness ending up behind bars instead of getting the help they need. It's an issue that costs us all, and the Department of Corrections says a different focus on mental health issues could help solve the problem. Another 150 Idaho inmates are headed to Texas because Idaho prisons just don't have enough room.
We certainly have seen an increase in our inmate population that corresponds with the increase in the population of the state.
And we live in one of the fastest growing states in the nation, increasing 460,000 people since the year 2000. And a huge portion of Idaho inmates are diagnosed with mental health problems.
Over the course of time, prisons have become the de facto mental health facilities in the state of Idaho. 56% of our population is being treated for some type of mental health issue. 41% of those people are on some type of medication for a mental health issue.
No surprise, DOWELL says prison is not the best place for those with mental health issues.
Well, I think prisons inherently aren't a therapeutic place.
Those who deal with the mental health problems on the street agree that society may not be best served by putting the mentally troubled behind bars.
We even had people who have said, I just can't get myself under control.
Yeah.
They don't have family or they don't have a place to go, and we don't have a place to take them. The jails are packed, the prison's packed. You know, it's a tough pill to swallow.
But it's an age-old problem that keeps getting worse.
Idaho's mental health treatment in the community consistently ranks among the lowest in the nation.
As a result, police often find themselves off the streets while they try to find mental health beds for detainees, something they say happens daily.
Sure, it definitely impacts that. Anytime you take an officer out, we have minimum staffing numbers here, and a lot of times we're at minimum staffing because of vacations and sick time and things like that. And so that takes us to below minimums then when we've got somebody that's tied up on that call. It
may take a few brushes with the law, but eventually police say many people with mental illness, if they don't get help, often end up behind bars.
Even if we know that they've been in the system several times for mental health issues, but now they've committed a criminal act that requires their confinement in the jail, they're going to jail.
So what needs to change in Idaho?
I think it's helpful for the health of the community and the safety of the community, and helpful to the population in our prisons to have early treatment and diversion options for those with substance abuse or mental health issues. Absolutely.
Really, the issue boils back down to we need more treatment facilities.
We forget as a community, certainly as a society, that it costs money no matter how it's handled. Currently, the way it's handled is not very efficient.
But it all costs money. Now, Idaho inmates do receive treatment for mental illness, but one of the big problems actually is the structured life that goes on in prison that includes regular medication.
So why is that?
Well, the problem is that when you're on that structured system, right, and then you get out, it's so hard to keep that up for so many people, and that causes problems. So without that mental health support system outside of the bars, you really do have a problem with recidivism. So we need more of that to prevent that.
A story I'm sure we'll do more of.
Yeah.
Stay on top of that. All right, thanks, Roland. Police from 4 different